Hello, good afternoon. I'm Dr. Malan, and thanks so much for the opportunity to present. Prior to 2018, there was no functioning nuclear medicine department in Botswana, and patients had to travel to South Africa or to Namibia at great cost and at great inconvenience. And in the latter part of 2018, we started the nuclear service, Gaborone, and we started the clinic at Lenmet Bokomoso Private Hospital, Gaborone. I'll show you some slides of the department. On the first slide is the gamma camera where we scan the patients. It's in a single head SPECT system, and here is our state-of-the-art hot lab where we prepare the radiopharmaceuticals. In Botswana, we offer most of the standard nuclear medicine services, including bone scans, infection imaging, lymphoscintigraphy, thyroid scans, parathyroid scans, somatostatin receptor imaging, lung perfusion scans, cardiac scans, Muga scans, renal scans, and sundry. So what is nuclear medicine? In nuclear medicine, we perform functional or physiological imaging. So we look at the function rather than just anatomy, which is more attributed to the radiology. So we prepare a certain radiopharmaceutical which is specific for the type of scan that we will be performing. This is then injected or inhaled or swallowed, depending on what scan you are performing. The patient then becomes the radioactive subject and is then scanned, and the emission from the radioisotope is then picked up, and then images are formed. So we inject MDP for a bone scan, system maybe for a cardiac scan, HMPAO for a brain scan, and the last image is to show you where we fuse the functional images with anatomical images, and we have then the best of both worlds. So why are these images necessary? It's for the diagnosis of certain diseases, right, to assist in staging of diseases, in response or follow-up of treatment, and it ultimately allow the treating doctor to better assess and to treat his or her patients better, and ultimately impacts on health economics and the health care of the population. So we are not just a diagnostic specialty, we are also a therapeutic specialty, and we do treat certain benign and malignant diseases with radioisotopes. For instance, the Graves' disease, where the thyroid is hyperactive, and thyroid carcinomas or cancers, and then certain neuroendocrine cancers. So, as an example, these patients would all have similar blood results, and the clinical assessment would be very difficult to sort of absolutely differentiate between what is the actual disease of the patient. And by performing a radioactive thyroid scan, you can we can assist to differentiate between the various pathologies. I'm also showing a bone scan of widespread osteoblastic metastases, and it is specifically used in prostate carcinoma, breast carcinoma, the bladder, lung, and others. The advantage of the bone scan is that we perform whole body images. It's the same radiation dose, and you just need 15% change in the bone composition to actually pick up pathology, whereas you would require approximately 50% mineral content change is on a X-ray or a plain film to appreciate the same pathology, which means that a bone scan is exquisitely sensitive. So, what are the opportunities in Botswana? Well, SPECT-CT, a PET-CT, and then targeted therapies. So SPECT-CT and PET-CT combine anatomy and function. So by way of an example is on your planar bone scan, you may appreciate a focal abnormal uptake in the L5 S1 region over here. It's also seen here, and on the SPECT images it is seen here. So it is most likely facet joint arthropathy. But with the combined fused images, you can say for certain, that abnormal uptake is related to degeneration and reactive response of the lower lumbar facet joint. So we are currently performing targeted therapy for hyperactive thyroid disease, and it is a well organized machine. It is low dose iodine that we administer, and these patients typically don't need admission to hospital. The treatment of thyroid cancer requires larger doses of radioactive iodine, which then also requires a certain legal requirements. And I am pleased to announce that the building of the treatment facility at Bokamoso is well underway and should soon be finished.